On February 10th, this Friday, New York City will end its vaccine mandate policy for all city employees. The edict led to protest lawsuits, ultimately hundreds of city workers losing their jobs. But in the end, 96% of city workers got vaccinated. Mayor Eric Adams made the announcement on Monday, saying the mandate helped keep New Yorkers safe. But, quote, "This is the right moment for this decision. I continue to urge every New Yorker to get vaccinated, get boosted, and take the necessary steps to protect themselves and those around them." So what message does this send as we leave the emergency phase of the pandemic? Dr. Martine Hackett joins us now, a professor of public health from Hofstra University. Doctor, good morning.
Good morning.
So does this mean we're now living with COVID-19 and it's just not going away?
Well, as you mentioned, this is definitely represents a turning point. We have left the emergency phase of this pandemic. With 96% of city workers vaccinated, we are absolutely seeing a shift in the approach to dealing with coronavirus.
So what happens if there is a spike, though, of new COVID cases? Is there any way of turning back from here?
So we know that people are continuing to get the coronavirus, and that spikes are new normal. And so when it comes to being able to address them, we have to realize that we are in a much different situation than we were 3 years ago, to the extent that there are more people protected due to being vaccinated.
So there are health experts who believe this is the wrong move and that the city should be encouraging workers to get the bivalent booster. What do you think about that?
I think the bivalent booster is absolutely necessary. It's really quite surprising, the low uptake in the entire population of this important addition to protection against coronavirus. But those two are not mutually exclusive. You can encourage people to be able to get the bivalent booster and also no longer require the vaccine for city employees.
And will the city need to make any special accommodations for vaccinated workers with health issues who now may feel they are at risk?
So we know that the coronavirus, even though the vaccines have been successful in preventing deaths and serious illness, that there still remain people who are vulnerable. And those people have known that they're vulnerable and remain vulnerable probably for the rest of time. And so the ability for the city to make accommodations for people who have higher vulnerabilities should happen. But we also know that people have left the workplace because of their vulnerability.
Dr. Hackett, thank you so much for being with us this morning.
You're welcome. Take care.